You have to give quality time to your child. You and your child is watching TV together. This is not quality time. Quality time is distraction free time with your child. When child shares something, the parent should be supportive, and you should not always advise to your child. The child is suffering from these symptoms, then what you can do? You can go to a doctor or a clinical psychologist. The doctor or the psychologist will take the history. There is no shame, nothing. Like our body has some illness, our mind can have some illness, so there is nothing, no taboo associated with it. There are many factors which causes depression and anxiety in children. These factors may be some factors related to the home. The child may be subjected to some form of abuse in the home. There may be some problem between the parents. The parents may be separated. There may be a single parent. There may be some family conflict which is affecting the child. There may be a significant life events like death or health problem in the family. Sometimes if any parent is alcohol dependent, that may have a very bad effect on the psyche of the child. There may be some psychiatric problems in the parents which may affect the children, and sometimes comparison with siblings may also demotivate the child and make them emotionally vulnerable. Apart from that, there may be some child related factor, like what is the temperament of the child. Is the child is very sensitive? Is he very introvert? Is the child is lagging behind in the studies? There may be poor understanding of the subject. There may be some learning disorder hidden inside the child. The child may be addicted to some things like mobile phone or games or smoking, etc. And another very important thing which day by day it is increasing is gender dysphoria. What happened at around 10 to 12 years when the child started understanding about the gender more specifically? Usually the children will know about the gender by 3 years. But when the child will become 10, 12 years, then the child will have deeper knowledge about the gender. And sometimes what happens, a child may not feel comfortable at the gender which he or she is knowing from so long. Say suppose a boy is not feeling comfortable to be a boy. He likes the clothes of a girl or like to behave like a girl. So this can cause a very serious emotional problem, because this kind of things the child will not be able to share with anyone, and this child will suffer inside. So this is called gender dysphoria. There may be factors related to the school. There may be humiliation faced by the child at school, maybe due to some problem in studies, maybe some problem in learning. The child may be subjected to bullying or teasing. There may be groupism inside the friends. There may be feeling of left out in sports or gatherings. So this may also affect the child's emotional status. Hello friends, this is going to be a very important video, because today I will be talking about emotional issues in children. The children cannot express themselves. So if anything is hidden inside the mind of the child, as a parent it is important that you should understand them and you take appropriate action at the appropriate time, because if you delay your action, it will be detrimental for your child. The first thing you can observe in your child is whether your child is interacting normally or not. If you notice that your child has reduced the interaction with you or the other caregivers or with the friends, this may be a red flag for emotional issue in the mind of the child. Sometimes the child may become excessively tearful on small things. Just I am giving a small example. Suppose a child is obese, and from so many days whenever someone call him obese or make fun of him about his eating, he take it sportingly and he is okay about it. But you have noticed that from few weeks, this same child, whenever someone talks about his weight or eating habit of the child becomes very emotional. He started crying, become tearful. So this may be a sign of an emotional problem now happening inside the mind of the child. Many children have nightmares. They may talk at sleep. That may be a sign of emotional issues. There may be decreased sleep, frequent awakening during the night time. There may be complaint of repeated aches, pains all over the body. There may be fatigue, loss of appetite, vomiting, bowel upsets. These are some vague symptoms of emotional problem. There may be bedwetting, child may pass urine at night. There may be again reoccurrence of thumb sucking nail biting, etc. There may be poor school performance and refusal to go to the school. So these are some very dreaded signs that your child may be having some problem inside the mind, and as a parent it is your duty to find it out and take appropriate action at the appropriate time, because time is very important. So what are the symptoms you can observe in your child when your child is very stressful? Your child will be very much tensed. He or she will be very much dreaded, feel like choking, heartbeat will be very fast, hands will be shaky, feeling numb, body is shaking like that. So looking at this, you can think that there is some problem, there is some stress. Anxiety in children is very common. Some forms of anxiety are normal. For example, separation anxiety. It is normal for a baby from 8 months to 2 years of age. Because what happened? A 1-year-old child or a 1.5-year-old child will have separation anxiety. If you take the child from the parent, the child will be fearful, will be anxious. So this is called separation anxiety. This is normal. Similarly, preschoolers before 5 years or before 6 years, they will be afraid of darkness, monsters. So these are normal. So you should differentiate between what is normal anxiety and what is significant anxiety. There are many types of anxiety disorders, like social anxiety disorder. Whenever the child has to go outside, the child is not confident. He or she always avoid going outside. Then separation anxiety disorder can happen. School phobia, which is a very serious. The child is afraid to go to the school. Something has happened which lead to. So we have to find out the cause and treat accordingly or take action accordingly. There may be panic disorders, which is also a type of anxiety disorder. There is generalized anxiety disorder, which is very common. The child will be tensed about everything, like what will happen tomorrow in the school, what will happen, I have not done my homeworks properly, what will the teacher will say, how will I pass the exam, what will happen after the exam. Wherever he goes, whatever he thinks, he is always anxious. So this is a generalized anxiety disorder. If you find out that your child is having some emotional problem, so how will you deal with that? The number one thing is you have to give quality time to your child. What is meant by quality time? Quality time does not mean that you and your child is watching TV together or watching the mobile or watching a movie together. This is not quality time. Quality time is distraction-free time with your child, where you and your child is making bonding. You can do some activities like you can play something together, prepare your food together. This will lead to more and more emotional bonding. When you spend good quality time with your child, the bonding will be more. When the bonding is more, the child will express his or her problems to you. So this is called as vent out or ventilation. When the child will express his problem, whatever thing is inside the child's mind, the child will express itself, the child will ventilate everything, and the child will be relaxed. And when child shares something, the parent should be supportive, and you should not always advise to your child. For example, a child came to you and said that I have failed in one subject in class 10. So you should not get angry on spot and say, like, in our days we used to study hard, we never failed in our life, you have not done this thing rightly, you should have done like this. You should not advise. First listen what your child wants. When your child is expressing something, is in telling something, your child wants that you listen to him first. So always listen carefully, don't be judgmental, and then you reassure your child, yes, I am with you, I can understand, we will sit together, we will work together and find some solution. You reassure your child. So when you give quality time, your child expresses his or her problem, you understand the problem, you listen to your child, you reassure your child, work together with the child about the problem, then this will be very good. Sometimes what happens, there are some cognitive error in children, like error in understanding simple thing. So for example, there is a child who is anxious. Actually, her mother is working in our hospital, so she is very anxious that if her mother go to the hospital, her mother will have some illness, and because she heard that in the hospital there are many germs, so her mother may become ill and her mother may not be able to come. So whenever her mother wants to go to the hospital, she becomes very anxious. So in that case, you have to understand, you have to find out where is the error. It's a simple thing. You can reassure the child and say that I will take precaution in the hospital, I will do proper hand hygiene, I will use mask and do my job properly. I am having posting in so and so what where there is no such things, and I will again come back. You don't have to worry. So you have to explain to your child in a simple language and reassure your child, then most of the problems will be solved. Like I said, in generalized anxiety disorder, the child is always tense about the future. The child is always tensed about the future, what is going to happen, what will happen in the exam, how will I do my homework tomorrow in the school, what are going to happen, am I going to be scolded, so and so. Then in that case, you have to make him understood the most important thing in life is the present. You think about the present. So what is there now, you can change that, but what is in the future, you cannot change it. So you have to explain to your child that you think about the present, what are the options available, you work hard, you take some time out and do your homework, you study this, you do the revision. Then whatever happened tomorrow, that is not in your control, but present is in your control, and you take control of the present. Okay, you should not think like this, that, so many things. Your mind should be steady and you should think one thing, you should focus. For this there are many techniques. One is engagement with daily routine. We try to engage the child with giving a daily routine. We give them when to wake up, what to do after that, and study time, everything. We give a routine so that the child find a direction and become more and more disciplined. Another technique is giving small work. So this is a part of behavioral therapy where we give small work to a child, especially if the child is suffering from a depression. What happens that when the child achieves or successfully does the work, whatever is small work, when the child achieves success in that work, the child feel happy and good about himself or herself. So this technique also helps in alleviating emotional problems. Exercise is very important. You can ask the child to do yoga, meditation, breathing exercise, and most important thing is role model. As a parent, how you cope with a situation. Suppose you are depressed and you are drinking alcohol, you are angry with someone, you are throwing when you are angry and you are throwing things like this. So your child will see you and your child will also become like that. So you have to be a good role model. You also have to know how to cope a loss, how to cope a anger, how to cope everyday situation. So these are some simple tips that you can apply at your home, and most of the cases it is seen that by applying these techniques, it is very easy to take good control of most of the emotional problems in children. But even if the child is suffering from these symptoms, then what you can do, you can go to a doctor or a clinical psychologist. The doctor or the psychologist will take the history. There is no shame, nothing. Like our body has some illness, our mind can have some illness. So there is nothing, no taboo associated with it. So the person will take history, try to open up your child. In children, it is very difficult to make him open. Okay, but with repeated session, your child will open up someday. And when the child will open, there may be some stress factor. For example, I have seen one child. So he has many cut marks in the hand. So when we try to dig it out, we finally come to know that it's related to something social media engagement. So when the engagement was low, she used to feel bad and try to harm herself. Another case we've had was one boy was there, and unknowingly he had taken a book from another friend, and that book is with him from many days. Now he is feeling very ashamed and not able to tell anyone that that book is with him, and not able to give to the person, to the friend also, because the friend might thought that he has stolen the book, and that stress factor has led to lots of problems, and child is very much anxious all the time. So it takes time. Sometimes the child open up, and if the child is not opening up, there are many tests like draw a person test and other tests are there, and sometimes after doing all these tests we can find out what is the cause of anxiety or any other problem in your child's behavior. And lastly, we can take medicines also. So in children's also there are many medicines are available, and this luckily the side effects of these medicines are less, and there are safe medications for children's also nowadays, so we can easily treat any form of emotional problem in children. So I hope that this information will be helpful to you, and I wish each and every of your child to be happy and do success in life. And I wish all the parents that you just go through this video once again, try to understand what are the symptoms of emotional problem, what are the factors which causes the emotional factor, and if emotional problem, and if by any chance your child is suffering from emotional problem, you try to take the actions that I have told in the management section and try to revive your child from all this problem. And with this, I'm signing off. Thank you so much for watching.